So, welcome to the psychoeducation for today. Today I'm going to talk about curing impulse control problems. And impulse control disorders are many. We all can have problems with impulse control many times in our lives, so most people can learn from this video. One of the impulse control disorders that can be very troublesome for people and which affects almost 2 to 3% of people is hair pulling. People pull out their hairs and they can get bald spots, and it can be very, very stressful, especially for women. Another one which is very common, or is more common than we think, is skin picking. Picking on sores until they won't go away, until you look like you have some kind of skin disease. Nail biting is another one which is very common, which can be problematic, not as problematic as hair pulling and skin picking, but still quite bad for some people. Overeating can be deadly dangerous for many people and can lead to a lot of problems, self-image and things like that. And eventually substance abuse, that we cannot control an urge to abuse a substance, whether it is alcohol or drugs. So the good thing with these disorders, or these problem behaviors, is that they are governed by the same principle. First of all, we feel an urge. Feel an urge to pull hair, feel an urge to eat something, maybe sweet, feel an urge to bite the nails, etc. Then we do the behavior, we pull the hair, or pick the skin, or eat that cake, or drink that drink, and then we feel a release. And this is the problem, because you feel the release, you will want to do it again. So the behavior gets reinforced. But also, in many cases, you feel frustration because you've done it again. You can feel shame, you can feel depression and stress, and you will have an urge to stop this bad feeling. And what do you do then? Do more of the same behavior. You pull the hair, you feel badly about that, then you pull another hair because you're so stressed about it, and then you get even more stressed, and then you pull another hair, etc. So it's a very vicious circle. So the problem is that doing the behavior gets rewarded. You always get a little bit of release once you've done it. So this release comes so quickly that it overrides the frustration that comes after it. So it will continue, and it will usually increase if you've started this thing. So, how can we stop this? This might seem a bit simple, but the principles are very deep, and the more you contemplate this and do it exactly like I tell you here, the more chance you have of actually stopping this thing. First of all, you have to make a commitment to yourself that is unbreakable, that you really want to do this, that you really want to stop this. It's like picking up kids in preschool. You know, if you've committed to picking up your kids in preschool or somebody else's kids, you will never not do it, right? You have made a commitment to somebody else, but the commitment to yourself can be just as important. And this one is more important to keep if you're about to go bald, or if you're afraid of getting a boyfriend because you have bald spots on your head. Okay, this commitment to dealing with urges in different ways is very important. And another important principle is that urges are not reality. You feel an urge to do something, you feel that you really have to do it because you haven't tried many times to not do it. But could you resist it if you had the gun to your head? Probably. You could probably resist it then. If somebody said, I'll blow your brains out if you pull another hair, you'd probably not pull out the hair. I'll blow your brains out if you take this cake. You probably wouldn't do it. I'll shoot your dog, or I shoot your kid if you take another drink. You wouldn't do it. So, in principle, you're able to stop it. Your actions are actually independent of your urges. For instance, many people who pull their hair, they do never do it in public. So it is under a control, but the determination to do it hasn't been there, and you feel that once you get the urge in privacy, you just have to do it. Another thing is to deal with triggers. For instance, to put your hand in the hair is a very strong trigger to pull the hair. So as long as you can keep the hand out of the hair, you have a chance of stopping it. Good lighting in the bathroom is a very big trigger for skin pickers. Just turning down the light there, or never putting on the light when you go into the bathroom, is one thing that you can do to reduce it considerably. To walk past the bar on your way home, take another road. Never go to the bar area. To have a fridge full of cake is not such a good idea if you try to control your overeating. Another thing is to keep busy. For hair pullers, it's very good to keep your hands busy. Hair pullers and skin pickers and nail biters. For instance, by having a pen in your hand, by squeezing on cush balls or other balls, by knitting, for instance, pen in the hand, and a positive competing activity. For people who have problem with eating and drinking and using drugs, if the urge immediately makes you go into a positive activity that prevents you from doing your bad behavior, this can help a lot. But you have to be consistent. You have to do it as often as you can, as often as the urge comes. And that's where we get to so-called habit reversal. That you can train your brain to react differently when you get urges. Do something that makes it impossible to do the thing you have an urge to do. For instance, for hair and skin, it becomes to hold the thumb. To hold it like this in your hand, gently, nothing forced, and to hold it for 1 minute. That's very effective. When it comes to eating, it could be using hands for something else, making something, caressing somebody. Just immediately when you feel the urge to overeat, do something else with your hands. Drinking and drugs, I would say engage in a positive activity that makes it impossible for you to drink. Sports, cleaning up the house, playing with the kids, but as quickly as possible. Talk to friends could be another. But get into it as quickly as possible. For instance, the moment you have the urge to pull your hair, grab your thumb and hold it for at least a minute. The moment you feel the urge to drink, go and play with the kids as soon as you can. They will be very happy. When the urge comes, you can use it like an alarm clock. You say, now the urge came. Then it's my time to play with the kids, wash the dishes, etc. It seems too simple, but you can train your brain to react differently. And actually, the urge can remind you to do something good. Use your urge to your advantage. Okay, so these were some very simple advice about how you can control urges and stop destructive behavior like hair pulling, skin picking, overeating, drugs and alcohol and nail biting. Okay, please subscribe to the channel and make as many comments as you can. Start a good discussion on these pages.